Welcome back to the Rock Doc Chronicles. I am your ever-loving Rock Doc, Randy Sharma. There's a lot going on right now. I know everybody seems to be, is really concerned about coronavirus. Yesterday things are moving so quickly, it's hard to keep up with it. And so it's really important that we understand the disease, that we don't panic. You can't spell pandemic without panic. Let's take the panic out of pandemic. We'll backtrack a little bit and talk a little bit more about the disease. But I've been watching social media, and one of the people that's really been using their social media to get out some of the important points and updates on this is Columbus City Council President Shannon Hardin. So welcome, Shannon.
Thank you so much, Mr. Rock Doc, for having me on the show.
Oh yeah, thanks for making the time to come out. I know it's been really, really busy.
Of all the things that I wanted to be on the Rock Doc show, I would have never guessed we'd been talking about coronavirus in mid-March.
I know, but I do appreciate you using your social media platforms to kind of keep people updated on the latest advice and counsel from the CDC. And from the Ohio Department of Health, and then the city is working lockstep, with them.
Most definitely, right? And we have our health commissioner who's over the city of Columbus and Worthington, Dr. Mashika Roberts. What folks should be most proud of right now is that local and state government works well. It works really well. I'm a Democrat, but I have to applaud the leadership that is coming out of the governor's office, Governor Mike DeWine. Dr. Amy Acton, who is our state health director, has been doing an amazing job, and we have been working extremely closely with Dr. Roberts and Dr. Acton. And truthfully, me as an elected, all I'm doing is becoming a parrot for what I hear from my health officials. I'm not saying anything that I am not hearing directly from them. And the reason why I took to social media is because there's been a lot of stuff that is going all over social media. I wanted to make sure that folks know who directly to listen to.
Yeah, and that's the thing is we have to get the facts, right?
Yeah.
And especially, I think from the federal government, from that level, there seems to be a lot of, I don't want to say misinformation, but some things that are misleading and confusing. And I think it is leading to some panic, right?
Certainly.
So let's talk a little bit about what we know about this disease. So the coronavirus is, there are coronaviruses. Those are viruses, a family of viruses that have been out there and cause colds. It causes 40% of the normal colds. This just happens to be a mutation.
Right.
And it seems to be a little bit more aggressive or can be. And the other issue with this one is it's spreading pretty easily. And so about 80% of people probably are going to have mild symptoms, right? And then
so what I've been hearing is, because it's really important that we listen, we take this very seriously, but that we don't overact and we don't panic. Right. For most people who listen to podcasts, by most 89, and I don't want to give percentage, most people are going to be okay, fine. Right. But what the issue is not for you and I, Doc, but it's for us who have a loved one who is 75, 80, 90 years old, or someone who has dealt with a chronic illness. Our engagement with them is serious. Right. And so I'm trying to talk to younger folks in particular, my age and younger, and specifically, truthfully, people of color who are, I've heard stuff on social media about, black folks don't get this.
Somebody said that yesterday too, and I was like, what? Where did somebody get that
It's really
from?
not funny, and I really am encouraging, my little cousins and social media folks, what do they call it? Social media influencers or something?
Yeah, the influencers, sure.
To be really careful. The one thing that I would tell other folks who are listening to this, do not post anything that you do not get in Ohio, from the Ohio Department of Health, or from Columbus Department of Health. If it does not have a actual post on it do not repost it, because it's scary.
And the CDC does a great job, has been doing a great job as well. And so the reason that we have to, right now, one of the things that happened today was a couple things. The governor, who has been doing, as we had said, doing a great job having these daily press conferences and leading, making sure people have the facts, and it has been pretty aggressive in his action that he's taking. Today, the big things that kind of came out of nowhere, not once out of nowhere, but they were kind of giving us an idea there were some big moves that were coming. They've ordered that there are no gatherings for the meantime of more than 100 people.
100 folks.
And also that the schools are going to be on a 3-week spring break starting on Monday.
Yep.
So again, this kind of goes back to, it's so contagious. We don't, you don't want these ginormous gatherings of 20,000 people or 1,000 people because it's going to spread for prolonged periods of time, because it'll spread easily. And it's not our age group that's probably going to get hit that hard. And especially children seem to be doing very, very well with it.
Yep.
But it's that we are going to come in contact with people that, whether we know it or not, either have one of those, chronic medical conditions, whether it's lung disease, heart disease, diabetes would be on the list. Obesity may actually be one of those things that could affect us as well. And of course, our parents, our grandparents. Yeah. And when they get sick, when the people that get the severe respiratory symptoms from this, it happens quickly.
Yeah.
You were just in Washington, D.C., where, was it the head of the CDC had spoken?
Yeah, Dr. Wolf, who is the medical director for the CDC. We were there for the National League of Cities over the weekend, and I was really, it was actually a hard decision to be there or not. One, because it was a mass gathering, truthfully.
Sure.
But two, we were in the middle of, truthfully, a health crisis, and to be away from the city during that period of time, the value that came right away was, we heard from a leading epidemiologist on Monday, and right before we left on Tuesday, we heard from Dr. Wolf, who is the chief medical officer for the CDC, and really he gave information that you can tell that Governor DeWine has and is acting off of.
Okay.
These steps that we are taking, and I will say that we'll continue to take, are the prudent steps that need to be taken just to keep folks safe.
Yeah, I mean, having this, even with right now having the schools go on a 3-week spring break, as they're calling it. One of the things that we see when you have respiratory illnesses in December is you'll actually see a dip in those numbers during the Christmas break, because kids, they're touching everything. They're going to hug on people. They're not necessarily going to wash their hands. So,
and you might be able to speak to this too, Doc. One of the things that he said, there's so many unknowns, but one of the unknowns is how the warm weather will affect this.
Correct.
So that might be one of the positive signs that we may see down the road. We don't know.
Right.
Is how, if we see this bell curve of infection, will warmer weather in the next month or so change some of the outcomes?
And to some extent, these things will, just by the fact that in the colder months we're all huddled in, we're inside, and we're so in the warmer months we do tend to be a little bit more spread out. We tend to be outside a little bit more. Now, one of the things for me that's been really frustrating is the lack of testing kits.
Yeah.
It's because right now, even though in the state of Ohio, I think we just had a 5th person test positive. Yeah. But in all likelihood, I don't know. I would guess, just knowing that younger, healthier folks tend to just have cold symptoms, and we've had a lot of people coming in with cold and flu symptoms still. I would expect that it would be in the thousands probably, in Ohio.
I'm trying not to say anything that I have not directly heard from a health official. One being my health commissioner, or two being Dr. Amy Acton. But me as a leader of a city of 900,000, I'm not focused on the confirmed cases. Right. We are acting under the assumption that this is a spreading virus.
Okay.
And that, to your point, we know that we don't have enough test kits to get everyone tested, and so that's why we're asking for everybody to practice some new skills. One of the things that Dr. Acton said today that really should get us in the frame of mind: this is our generation's 9/11.
Wow.
This is our generation's 9/11. We will all remember where we were and how we were affected by the next couple months that we'll go through. And so we need to take it seriously, and we need to think about how we learn new skills, like what's it called? Social distancing.
Right.
we are filming a podcast, and I love you document specifically because I'm a politician, and I think that we are in ourselves super spreaders because we're out shaking hands so much.
Yeah.
And you're a doc, and so
Yeah.
you're going to be around folks. We are sitting 5 feet away from each other.
Yeah. Yeah. Sure.
And these are things that over the next weeks and months we all will get associated with. This is our new normal for a while, as Dr. Acton says. And so when we think about, again, you and I, we believe 40% of folks will acquire this virus.
Yeah, I think like 40 to 60%.
So a lot of us are going to get this. We got to take away the stigma from it.
Right. So if somebody does test positive, or if you end up having been in close contact with somebody that has tested positive, and you're going to be ordered to stay home. You're going to be self-isolate.
Right. Yeah.
And we were kind of talking about this, like there shouldn't be a stigma with this.
No.
It's actually you're doing other people a service because this is so contagious.
It is,
right. And you don't know who's going to be who's around and how.
This is the thing, and this when I really I can't speak highly enough of what I've seen the last couple of days coming out of the governor's office. Absolutely. The governor did this analogy. He said, so you have this 25-year-old kid. He is healthy. He, even though he knows he could or could not get this virus, he goes out to the club tonight. Mm-hmm. That's cool. He's fine. He's going out to the club. But where it becomes not cool is that he then is going to go to his grandma's house. And because he himself is cool and might have this either asymptomatic or low symptoms, low side of symptoms.
Sure.
He then is affecting his grandmother. And so when we ask folks to stay away from big gatherings, and we ask folks to start to practice these social distancing practices, it's not about us, man. Like this is going to be one of those things where we're asking folks to do this to take care of our moms and our grandparents. It is going to be that serious that we start to think about how we interact with one another over the next couple months, how we look out for one another. One of the things they also said was, be careful about how we look out for one another. To me, that whole point about this is our 9/11, and we will learn how to take care of each other like we did around that time.
Yeah,
I thought that was really impactful.
Yeah, and one of the other things, you start to question, how did this become so widespread, and how is it spreading so much? But it's not comforting. I'm not going to say it's comforting, but it's somewhat comforting. You see these numbers, like, because here's why I don't want people to panic. The reason it was able to spread so easily is because the symptoms generally are very mild in most people. When you had something like a SARS or you have an Ebola, you immediately know, like, oh, this person's sick, quarantine them, whatever. In this case, you don't. So yeah, it's certainly out there. So we shouldn't. The reason I bring that up is I don't want people, because now the tests are going to be more readily available. We're starting to see them roll out. I know Ohio State University Hospitals, the Wexner Medical Center, and Ohio Health, the Riverside Grant. Those hospital groups have tests. They have an algorithm that people go through if they call in and there are concerns, and now they can do more testing. We're going to see a lot more testing coming up. What I don't want people to freak out about is I think we're going to see a huge spike in the number of positive cases, in the thousands, tens of thousands, right?
Yep.
That doesn't mean that it's doom and gloom.
No, and that's why, again, I've said that I'm not the actions that the governor is taking and the actions that we are following from the city, from the state. These aren't actions because we have a confirmed number. We are not associating our actions with a number because the numbers are so off.
Right.
And so when you see the spike, don't get any more that should not be a cause for panic. It should be a cause for listening to Dr. Acton and to your health officials. Like it's going to, you just got to follow what we're already saying around social distancing, around staying at home if you get sick. These are all things that we should be we will, as a community, as a country, be practicing over the next 6-8 weeks.
Yeah. Now, the other thing that is interesting, and I'm speculating here, so this isn't a medical fact.
Yeah.
But It kind of is. But speculating. So the one thing that happens when you do have this widespread outbreak, let's say you get that 40, 50, 60% of people get exposed to this. When you get exposed to it, even if you don't get super sick, you're going to build antibodies to the virus, right? So as long as it doesn't mutate, we're going to have
the next round of it.
Right, but then what will happen, as long as it doesn't mutate, what will end up happening is enough people will get exposed that, just like we do with vaccinations, as long as people get their vaccinations, you get that herd immunity where even if somebody wasn't vaccinated, if everybody around them is, they're not going to get sick. So there is the thought out there that if enough people actually do get exposed to this and build those immunities and the virus doesn't mutate, that actually could be protective at some point, especially for the older folks that we're kind of trying to keep
100%. Would you talk about? I don't know if you can talk about the bell curve that we're trying to. So Dr. Acton.
Yeah, she says the pandemic curve.
Yeah, the pandemic curve, and this is why we need to be. Why we need to follow the rules but not panic is that we're trying. What we really are trying to do is not overwhelm the healthcare system.
Yeah, you don't want to because what happens is if you have that, so this is going to spread exponentially, right? And so as it goes up, as that one infection becomes 2, becomes 4.
She said today that it will double every 6 days,
and I would not doubt that at all. And of course, now that we have this community spread. The science behind that is usually when you start seeing that community spread, there's probably about 1%, at least 1% of the population that's infected. That's why that's where we're getting this whole idea of like there's probably thousands of people, if not tens of thousands, just in our state that probably have been infected or exposed. So, but what you want to do is we want to try to. That's why we're isolating people, is because it does spread. So it's going to spread quickly. And when people do get sick, those people that do get sick are getting sick really quickly. You said that Dr. Wolf had said that.
Yeah, he in briefing the group at NOC, he was just talking about some of the things that they are learning. I'm jumping around, learning from places that have gone faster, going through this. Seattle being one of our ground zeros here in the States. There was a ground zero nursing home up in a suburb of Seattle where the first 10, 12, 15, I think even 19 cases are people who have passed happened out of that healthcare center.
Yeah, but you said that the Dr. Wolf said it happened really quickly. Like the people got sick, and within hours they were and that's because they're the immunocompromised ones.
It is because they were older and had underlying health risk.
But what we're trying to do is when it does happen, it happens quickly. So that's why we're so hot on like kind of this social distancing, trying to limit the size of groups to gather, because that's like you get 100 people there, you get, or let's say a concert like 5,000 people, and you get a few thousand people that actually were exposed or do get infected, and then they got in the community, and that's going to spread quickly. So you want to try to cut that off. You want to decrease the exposure that all of us have, and in turn the exposure that other people have to us to a certain extent, right? And then because when the people are getting sick with this, it becomes such a shock to the respiratory system, and people need to be on ventilators. And there's if it gets widespread, I think in Italy they're having issues because there's not enough ventilators.
This whole game, for folks who have not seen today's in particular's briefing from the governor, I would encourage folks, and today is
Thursday, March 12th, I think.
Thursday, March 12th, where they announced the 100 or more cancellations of events and the school closings for the entire state. I would encourage folks to watch it, because I think, again, this is not something to panic about. If you have the information, understand what we as a community, as a city, as a state, and as a country about to go through with this. It's not scary if you just understand these are going to be big steps. These are going to be. Remember when the airplane stopped flying after September 11th?
Oh, that was eerie.
How mind-shocking that was. We're going to have a couple of those trippy events over the next several months that we just had never seen before. I've read before I got here, Disney World has
Disneyland, yeah.
Disneyland for the first time ever.
Yeah, until the end of the month.
Yeah, those are the types of things that we just need to take it seriously. As we go through this, listen to the health providers, and we will be fine.
Yeah, we will be fine, and everybody's making those moves. You're right. I'd gotten a couple of questions earlier this week from, actually one was from Nina West of all people, and then another one was from a person who's manages a large stable of artists, and it was the question was, what do we do? What do we do about this? And at first it was like, well, earlier in the week, and things again, they're evolving so quickly.
Yeah.
My first comment was cancel the meet and greets for sure.
Yeah.
And then of course suddenly it turned into we're just things are just being shut down. So, because on two fronts. One is especially with meet and greets and people that are traveling a lot and touring, you're going from city to city. They're probably going to end up being exposed, but then they're going to take it to another, large. So that's, so that today, Broadway shut down.
Yeah.
Live Nation, huge concert promoter, shut down all their tours.
Yep.
And that's appropriate.
These steps, they may seem drastic, but these are the appropriate things that we need to do to affect that bell curve. This whole game is about not overwhelming our healthcare system.
Right.
Again, you and I are not probably will not get as sick, but we have loved ones that if we get sick, they will have to go to the hospital. If they all have to go to the hospital in the next week or two, all at the same time, that is a problem.
Right.
And so, we just need to listen when they say don't go to big events. Don't be careful even as you go to clubs this weekend. The weekend the guidance is, and it sounds silly, 3 to 6 feet. Social distance is 3 to 6 feet from somebody. If you're in a confined space where air is not circulating for a while, you should be looking for spaces that have 3 to 6 feet.
Yeah, and I think in most of the cases they're saying when people sneeze or cough, it's about a 6 foot radius or area that that is probably where they're infective, where the respiratory particles are still infective. So again, one of the things that we've mentioned this several times, these daily briefings that the governor and Dr. Acton have been doing are super informative.
Super informative.
The actions that Governor DeWine is taking are actually pretty progressive because he's
extremely progressive. We're ahead of other states,
and then you see the rest of the country kind of follows.
That makes me feel more comfortable.
Oh yeah,
it definitely makes me feel comfortable.
And you kind of made an interesting comment, and you're absolutely correct in saying this. These actions that that Governor DeWine is taking they're saving lives. We just don't know it.
Yep.
Because
we will all. This will all be judged on the other end of this. We're at the beginning. I don't know where we are in this, but he said, they think that it will peak mid or late April, mid-May. Mm-hmm. And so we will just be going through this kind of together. And it's really comforting when you know that there's a plan.
Yes.
And we have a plan, both on the city and state level. There are folks planning. There are folks who have been working, Dr. Acton said, have been working round the clock for several weeks on this.
Sure.
To plan. So my message to everybody is follow their lead. If it's not coming from Ohio Department of Health or from our Franklin County City of Columbus Health Commission, that's the real information. That's the best information that we have at the time.
And be careful what you see on social media.
Be careful what you see, and certainly be careful what you spread, like in terms of misinformation. Like people can get scared about this.
Right, and we don't need to.
And we do not need to. So let's just be careful. Let's look out for one another.
Yep.
And we are all going to be cool.
Awesome. Well, I think we had a few people that had some questions, so I'm going to get to those in a minute, but really appreciate your time. I know right now there's a lot going on aside from just being, your duties as city council president and making the time and helping educate people.
One more other thing is this is all happening in the middle of an election.
Correct. Oh, yeah.
And so I just went this afternoon to early vote. We have been working with the Franklin County Board of Elections to make sure, and with the Secretary of State's office to make sure voting will go on over the weekend and on Tuesday on Election Day. We're actually asking folks, young and healthy, if they can go to the Secretary of State's website. We need more poll workers because poll workers are usually older.
Didn't even
And
realize
so
that.
we're asking them to stay home, and we need younger folks to work the polls on Tuesday. So go to the Secretary of State's website. They will get you in touch with your Board of Elections, and we would love to have people to work the polls. This is a time when we need people to step up and do the things for each other. We're going to have to take care of each other over the next couple months, and this is one of those things. This is a patriotic act. But two, go vote. Go vote.
Yeah.
When I voted, they cleaned the voting machine after each vote. I did press with my knuckles to make sure, but I use hand sanitizer after. I practiced social distancing, so there was 6 feet away in between us, but it was safe. It was safe, and it's the most important as we go through this period that we are keeping this norm. Voting is really important, and we need you guys.
We absolutely do, and thanks for letting us know that that they were asking for poll workers. That's because usually those are older folks, and we don't want to expose them if we don't have to.
Right.
Well, thanks again for your time, Shannon.
Thanks, Rock Doc.